1 year ago, President Barack Obama signed the controversial Patient Protection and Affordable Care Act into law. And as the first anniversary of ObamaCare approaches, the law is now more unpopular than ever. So how is the president's prescription for health care reform faring? Joining me from Portland, Oregon for a checkup on Obamacare is Dr. Douglas Perednia, a medical internist and dermatologist and author of Overhauling America's Healthcare Machine. He also blogs about the healthcare industry at roadtohealth.com. Dr. Perednia, 1 year of Obamacare, already 1 year. How would you rate this law?
I'm afraid I'd have to rate it a terrible failure. Even as of now, most of the policies and major programs in the law haven't even gone into effect, but it's already gone way over budget if we look at any serious type of accounting. And it's added terrifically to the complexity and cost of the care that we're providing every day. If for no other reason than people are confused and really don't know what to do or what course of actions to take.
Before the bill was even passed, you'd been writing about some of the bureaucratic trends in the healthcare industry. What types of inefficiencies did you encounter?
Oh, gosh. The big problem we have with healthcare in America today is not that we're spending too much. We're a rich country. We can really spend whatever we want on it. The problem is that the money we're spending is being spent inefficiently. In essence, we're completely wasting at least a third of all of the dollars we're paying in both taxes and premiums to buy our healthcare goods and services. Much of this is being consumed by the growth of administrative overhead expense. The graph you're seeing here is a graph of the increase in the number of just one type of healthcare administrator since 1970. The little yellow line on the bottom is the number of physicians, or the percentage increase in the number of physicians. The blue line is the percentage increase in the number of healthcare managers. And as you can see, there's been a 30-fold growth in the number of managers compared to only about a 50% growth in the number of physicians. So what we're doing is we're essentially taking about $600 billion a year and spending it on things that don't improve anyone's health in any way, shape, or form.
So basically what you're saying is that physicians are doing more administrative work when they should be concentrating on helping patients. They're so busy doing paperwork nowadays.
Not only are they doing paperwork, but they're paying others to do paperwork on their behalf. The average doctor now spends over 5 weeks, 5 full working weeks a year, doing nothing but administrative paperwork for insurance and government regulations and everything else. They also pay about 15% of their gross income, that's of every dollar that's taken in, on just the process of medical billing and dealing with insurers. If you look at their total administrative overhead, it's 30% of every dollar they take in. Now, compare that to other professionals like accountants and attorneys. They typically spend no more than 1% of the total amount of money that they take in on administrative overhead and billing.
Unbelievable. Has Obamacare addressed any of these issues, doctor?
Well, that's part of the problem. Not only does it not address the issues, it actually makes things a lot worse. The program has about 168 brand new programs, regulatory agencies, and other types of features, I guess you'd call them, that will actually increase the complexity and the number of administrative nightmares that everyone has to face every day. And that's not just physicians, it's nurses, it's patients, it's people in families who have to deal with insurance plans.
Mm-hmm. And this bill is so complex.
But not only is it complex, but it has a number of attributes which are downright, how can I put it diplomatically, counterproductive. One of the first things that the president and the Democratic Congress did after President Obama took office was pass the High-Tech Act, which basically forces all of the doctors in the country to use electronic medical records by the year 2014 or suffer reductions in the payments that they have. That would be fine, except that there's absolutely no evidence that the use of electronic medical records improves health care, improves costs, improves efficiency, and it costs a phenomenal amount of money. The average clinician, after they get an electronic medical record, has their productivity declined by between 30 and 50%. And that's a very serious decline in an industry that's already suffering from massive inefficiency.
Yes, absolutely. So what needs to be done to overhaul the health machine?
Well, there are a number of very simple things we can do in very short order, frankly, if we would just have the courage to do them. The first thing is to stop trying to eliminate free markets in healthcare. One thing we could do very simply is, instead of using a very complex government structured set of fixed payments for every different thing that a doctor does, we could simply pay doctors by the hour. Their overhead would then plummet because all they have to do is keep track of the number of hours, and they could pass those savings directly on to patients and the insurance companies that provide the payments for their care. Another thing we can do is get rid of a lot of ridiculous government regulations that appear to have absolutely no purpose other than to facilitate control over the healthcare system. There's a great new example. Just on January 1st, Medicare is now requiring that doctors personally sign every single lab form that they submit for a patient to get labs. That's going to result in at least one additional full week per year for physicians doing nothing but signing those forms. That's all they'll be doing for one full working week a year.
Then why aren't we doing this? Is it all about the almighty dollar?
Well, it's a great question. It really has very little to do with dollars, and it's all about control. For reasons that are a little bit complex, I guess, and historically there was not really any planning in healthcare. And since the late 1970s, the government has been increasingly trying to control every aspect of the provision of healthcare goods and services, whether it's what the pricing of those services are, who will get them, when they'll be allowed to get them, how they'll get them, what kind of quality physicians have to provide. And every time you add another requirement, another element of control, things actually get worse, because the people in the government, they're not in a position to know what any given patient needs. They're not in a position to know what's appropriate and what's not appropriate. And so you have a situation very much like in the old command economies of the Soviet Union, or in countries like China in the old days before China developed markets, where you have people producing a lot of things inappropriately simply because they're told to by someone who isn't there.
Well, hopefully we'll see some changes here very soon, Doctor. Thank you so much for joining us here today.
It's my pleasure. Thank you for having me.
You can find more of Douglas's work at roadtohealth.com, and be sure to check out his book, Overhauling America's Healthcare Machine, available on Amazon. And viewers, please come join the conversation. How will you celebrate 1 year of Obamacare? And will Congress even ever repeal this bill? Let us know what you think in the comments section below. For PJTV, I'm Danika Quinn. Thank you so much for watching.